My name is Cassandra Henderson, and I'll be doing an educational presentation on atrial fibrillation and anticoagulation. The learning environment. The learners will be currently employed registered nurses on our telemetry unit at the hospital, and the education will be provided at a lunch and learn. The objectives. By the end of the learning lecture, the nurse will be able to 1. Examine the pathophysiology of A-fib, 2. Explain the mechanism of action of warfarin and direct oral anticoagulants, and 3. Reflect upon education opportunities for patients regarding A-fib and its medical management. Evaluation criteria. At the end of the learning activity, there will be 3 questions. There will be multiple choice or true-false type questions, and the purpose is to assess if the learning objectives have been met. Introduction to AFib. It's the most common cardiac arrhythmia. AFib accounts for nearly a third of cardiac rhythm disturbances related to hospital admissions, and approximately 32 million people worldwide are affected by AFib. It poses a significant risk of ischemic stroke. And anticoagulation reduces risk of stroke occurrence, but must be balanced with the risk for bleeding that anticoagulation poses. Diagnosis is most often made with an ECG, and it's an irregular heart rhythm. The pathophysiology of AFib. Irregular electrical impulses from the atria cause a disorganized heart rhythm. Can cause rapid ventricular responses with a heart rate between 120 and 180 beats per minute. It results in incomplete atrial emptying, which causes blood to swirl and pool in the atria. AFib may have no signs or symptoms. Often the only reportable symptom is fatigue. Other commonly reported symptoms include palpitations, dyspnea, diaphoresis, and dizziness. Severe signs can include pulmonary edema, stroke, chest pain, and hemodynamic issues. Causes and risk factors for AFib can include surgery, pulmonary embolism, alcohol ingestion, hypertension, CHF, CAD, obstructive sleep apnea, advanced stage, and genetic disposition. The information here will help make sure that objective number 1 is met. Warfarin or Coumadin is one of the medications that patients with atrial fibrillation are often prescribed to help prevent strokes. Warfarin for many years was the gold standard for stroke prevention for patients with AFib. However, more recently it's fallen out of favor for medications with fewer limitations. Some of the limitations of warfarin include more than 120 drug and dietary contraindications. It has a narrow therapeutic window, a long half-life, and bridging is needed. And bridging is basically when a surgical procedure is needed and warfarin needs to be discontinued. The patient will need to be bridged in order to minimize the risk of a stroke. This includes discontinuing warfarin and replacing with another medication with a shorter half-life, usually heparin or Lovenox. If you're having a surgical procedure, you can't just stop taking warfarin. You're at a much higher risk of having stroke if you do that. Warfarin is an anticoagulant or a vitamin K antagonist. Its mode of action is that it blocks formation of clotting factors dependent on vitamin K. The INR should be measured often with a therapeutic range between 2 and 3. And warfarin, if you take it, it increases the risk for bleeding, but it does have a reversal agent, which is vitamin K. It's cheap, it's covered by most all health insurances, and the expected outcome when taking warfarin is stroke prevention. And this information helps make sure that objective number 2 is met. Another group of medications that are often prescribed for atrial fibrillation patients are direct oral anticoagulants. They're now considered the gold standard of treatment for stroke prevention in patients with AFib. In some studies, direct oral anticoagulants were as or more effective at preventing a stroke in patients with atrial fibrillation. They do have some limitations. Some certain medications in this class have a slightly higher risk for GI bleeding than warfarin. But the benefits over warfarin include a shorter half-life, no bridging is required, few drug and food interactions, therapeutic range is reached quicker than warfarin, and they have a fixed dose response. There's a few different medications in this group. Dabigatran or Pradaxa. This medication is a direct thrombin inhibitor. And then there's a couple other medications apixaban or Eliquis and rivaroxaban or Xarelto. These two medications, their drug class is a direct factor 10A inhibitor, and that's an enzyme in the coagulation cascade. The mode of action for dabigatran, it interrupts the coagulation cascade by blocking the clotting protein thrombin, and the apixaban and the rivaroxaban, they interrupt the coagulation cascade by blocking activated factor 10. When you take these medications, it's not required that you have routine lab work. As with warfarin, you're at an increased risk for bleeding, but with these medications, there's no universal reversal agent at this time. These medications are much more expensive than warfarin, and often your insurance company will only pay for one of these medications, so you don't really have a lot of a choice sometimes which one your insurance will cover. And as with warfarin, the expected outcome is stroke prevention. And the information here ensures that objective number 2 is met. A-fib can be due to a multitude of possible causes, which can make prevention difficult. It can be due to genetic and other non-modifiable risk factors, such as age and gender. It can also be due to environmental or lifestyle choices that nurses can provide education about, such as weight reduction, alcohol moderation, and increasing physical activity. It can be due to certain comorbidities. Some can be effectively managed to reduce the risk for complications, such as chronic kidney disease, CHF, hypertension, and sleep apnea. Nurses play a pretty important role in providing education to patients regarding atrial fibrillation, stroke prevention, and the different medications that can be taken. When patients have an understanding of why they're taking the medications and how the medications work, they're much more likely to be compliant with their prescriptions. When educating patients with AFib, taking warfarin and direct oral anticoagulants, the nurse can discuss the purpose and mechanism of action for the medications, common signs and symptoms of a blood clot, common signs and symptoms of excessive bleeding, required lab testing, and which foods and medications to avoid if taking warfarin. Some common foods to avoid consuming in large amounts include leafy greens such as kale and spinach. These are high in vitamin K and can reduce the effectiveness of warfarin. This can increase the risk of blood clot formation. And a few beverages to avoid consuming in large amounts are alcohol, cranberry, and grapefruit juices. These have been shown to increase the risk for excessive bleeding. And this information ensures objective number 3 is met. So now for the evaluation. Question number 1, AFib may be asymptomatic. The answer is A, true. AFib may have no signs or symptoms. Symptoms could also be very vague, like fatigue or dizziness, and this question evaluates that objective number 1 was met. Question number 2, for a patient with AFib, what is considered to be a therapeutic range for INR while taking warfarin? The answer is A, which is 2 to 3. If INR is less than 2, it could increase the risk for stroke, and greater than 3 could increase the risk for bleeding in a patient with AFib. And this evaluates that objective number 2 was met. And the final question. You are a nurse providing discharge education for a patient with a new diagnosis of AFib. Which comment from your patient indicates further education may be needed? A, I will need to take my medication as prescribed in order to prevent a stroke. B, while taking my Eliquis, I will be at an increased risk for bleeding. Or C, while taking my Eliquis, I will need to get my blood drawn weekly to make sure it's thin enough. And the answer is C. Weekly blood draws are not required with the direct oral anticoagulants as is required with warfarin. And this evaluates that objective number 3 was met. There are a few references, and that is the end of my presentation. Thank you.